Okay, welcome back. This is Julie Burkhart. She worked for Dr. George Tiller before he was shot and killed in May 2009. And what you are looking at here is footage of Dr. Tiller's former clinic. This is Julie Burkhart showing us around. It's Rebecca Dryden, Rachel Maddow show producer, with Julie Burkhart there. The clinic closed down after Dr. Tiller's murder more than 3 years ago. It has been shuttered ever since. But after Dr. Tiller's murder, after the shutdown, Julie Burkhart started a foundation, and she bought Dr. Tiller's former clinic. And right now, she is in the process of reopening it. The plan is to open a full-service women's health center with everything from checkups and cancer screenings to abortion and everything in between. To get it done, Julie Burkhart has assembled a group of allies, some of them local and some of them experts in their field from all around the country, to help make this seemingly impossible thing happen. This week, Dr. Tiller's clinic was full of contractors working on remodeling the building, and it was full of people who were working to reopen the clinic by all the other means they know how to as well. Ye Olde Rachel Maddow show went on the road this week to see what is going on at this clinic in Kansas. So you will see tonight and hear from several people who are involved in this project. I want to mention one note, though. There is one person who you will hear from tonight, but you will not see. It's a doctor who has signed on to provide abortions at the new clinic. She has asked us to protect her identity for her own safety. She's not from Wichita. She will not be living in Wichita. She will fly in from out of state twice a month to provide abortions at the new clinic. We have obscured her face and disguised her voice at her request for safety reasons, but you will hear from her tonight. The people involved in trying to reopen this clinic, who you are about to meet, what we found is that they know what they are doing. They are fully aware of what they are up against. And most importantly, they know what the stakes are. Their plan to open this clinic back up will bring abortion access back to the heart of Kansas. 3.5 years after Dr. Tiller's murder ended that access. And they are doing it at the very place where Dr. Tiller provided that access for decades. Watch.
At first, when we were discussing this, with board and, supporters, we weren't entirely sure that we wanted to come back into this facility. So there was a long debate about that. And we looked at a lot of other facilities. But we really came to the realization that, for a medical facility to provide the type of health care that we want to provide, this is perfect.
I think that, being back in the clinic, you can feel the positive, good spirit of Dr. Tiller. I really think we can all kind of feel that, those of us who were lucky enough to meet him and know him.
It's a wonderful thing to be in this building. This is Dr. Tiller's building, and when Trust Women bought the building, it was just a joyful thing to be able to maintain this site. And so there's optimism everywhere walking around here. This is a group that's absolutely committed, and they're going to get it open, and it's going to be wonderful.
I think it's incredibly symbolic of what we're doing in the women's rights movement. I mean, from a personal perspective, someone who worked here, this clinic just really embodied love and compassion and justice and good health care for women. And so that's what I think about is just what we're going to be able to bring back to the women of Wichita.
Do you see personal risks for yourself involved in just being an abortion provider?
I would like to say no. I have some amount of concern for my safety. However, I feel that those concerns I can't allow those concerns to affect the behavior that I do and to affect my determination to provide mainstream healthcare services to women who need them.
I think the biggest challenge is trying to juggle all the obstacles at one time. It's the anti-abortion groups, it's some of the legislative work that is really trying to stop abortion in this state. There are some people who want Kansas to be abortion-free, and they're in the legislature. So that's a big deal.
This has been a hotbed of activity, and we're here to do everything we can and make sure that the pro-choice community of Kansas and Wichita has a peaceful transition as this clinic reopens.
I have the flyer here from that was distributed in your neighborhood, and it calls you an abortion homicide promoter, and it lists your home address, and it asks people to go to your home and talk to you. Is this scary to you, to have this distributed and to have your home address and it has your picture?
Well, it's something that I take very seriously, and something that we communicate with regularly. We communicate regularly with law enforcement on this issue, any other issue that might arise. But it does give one pause, because these are folks who now know my home address. They can attempt to monitor my actions, and they can do that to any other employee here at the clinic. So it's something that we take very seriously, but it will not deter us.
I feel that if those tactics are successful in dissuading physicians from providing a legal protected medical service to their patients, then it allows them to win that battle of depriving those women of access to care that the women themselves have decided they need.
I think the community is long awaited the reopening of this clinic and is going to celebrate its reopening. I think that this is a very bright spot of hope, having this clinic reopen. And it's going to be a challenge, there's no question. But it's a hopeful challenge, and it will be a comprehensive reproductive health care facility that, whether you're here for a pap smear, whether you're here for an abortion, whether a woman is here for prenatal care or a pregnancy test, they can come here and know that they're going to get excellent care, unbiased care, and that's what the city's been waiting for, again, for a long time.
We're joined now on set by our own Rebecca Dryden, who is just back off the plane from this reporting trip. Welcome back, Rebecca.
Thanks.
Obviously, talking to all these people involved in trying to reopen this clinic, they're very confident they are going to be able to do it. From your assessment being there and knowing what you know about why that clinic is not open right now, do you think it is a done deal that this clinic's going to be able to reopen?
I would say it's not quite to that level yet. I think, again, absolutely, they are, Julie Burkhart, everyone she's working with, they are incredibly confident they're opening, and they're opening soon. But they do still have obstacles. There's one anti-abortion group locally in town that is working on petitions to try to rezone the area where the clinic is so that you would no longer be able to provide medical care. So you couldn't operate a medical facility in that area where the clinic already exists. Obviously, this is an area where medical facilities, this very medical facility has been
for years.
For many years.
And are there any other medical facilities in that area that they'd be inadvertently shutting down too?
Well, there actually, it's an interesting question. There is a sort of medical facility right next door to Dr. Tiller's old clinic, which is it's a crisis pregnancy center. It's one of the places where they try to talk you out of
anti-abortion lecture place, right?
Exactly, but they do, they do sonograms and they call themselves a clinic. So, and that's been there also for many years.
Oh. What about opposition from the state? We saw one of the women who you talked to there mention that the state is part of the issue. I mean, it doesn't get much more conservative or much more anti-abortion than Kansas Governor Sam Brownback and that very Republican legislature there. Are they also facing opposition from the state?
Absolutely, and they've since Dr. Tiller's murder in 2009, there have been dozens of new restrictions and a handful of bills that have been passed through the legislature and been signed into law by Governor Brownback. They have a new ultrasound bill. They have a new 20-week ban. They have a new trap law regulations, targeted regulations at abortion clinics. And that law specifically it's not being enforced right now. There's an injunction while the other clinics that exist in the state are suing to try to get it thrown out altogether. But not knowing what's going to happen with that law in the end, Julie Burkhart is planning for if it gets enacted. And
so they're building and renovating this clinic in conjunction or in cognizant of what those new rules would be. Absolutely. If they eventually get upheld.
They will meet those new regulations whether or not they have to.
Rebecca, I know also on this trip, these women who you met in Wichita, many of them worked with Dr. Tiller in some way before he killed. They obviously feel very connected to him and what he did. But I know you also visited the abortion provider in each of the 4 states where there is only one left. When you were talking with other providers in other states, does the Tiller example, does what happened in Wichita, the murder of that doctor, is that resonating in other states where there's only one provider left?
Yeah, absolutely. And this was something I didn't expect, honestly. We didn't go and ask these other providers about Dr. Tiller. We saw this as a completely separate story about what it's like to be the only provider in your state. We didn't ask any questions about it. Most often, they would bring it up after the camera was done rolling. We were just sort of chatting and packing up. But almost everyone we spoke to brought up Dr. Tiller on their own, completely unprompted. And not cognizant of each other. Some of them brought him up in sort of a reverential way and talking about what he meant for the abortion rights movement, what he meant for abortion providers. Most often he came up in terms of talking about security, and there's a real sense of vulnerability among these abortion providers that's come from what happened to Dr. Tiller. It's very much a present thing in their lives now.
Wow. This is at the very edge of what is supposed to be protected by the law, but is absolutely threatened by illegal, violent, threatening behavior. This is an edge of the Constitution in this country that is a leading edge and a burning edge. And you've been out there reporting on it this week, and we will have part 2 of our special report tomorrow. Thank you. It's good to have you here. Rebecca Dryden, producer on this show, who works really, really hard. All right. On Tuesday night, at the end of a segment that I did about Republicans trying to game the electoral system, I did something out of character, and I yelled at the camera, "Hey, Beltway, wake up!" It's a little stupid, but it turns out actually the Beltway sort of woke up. Part of it did. That's coming up.